in, Verys needle, assemble. Need some Raytex. Up here as well. Gonna load my knife handle because I need that as well for the case. Get it flipped over. Okay. On my Mayo stand, I'll need a couple more instruments than just a hemostat because you need to get in. So I need a couple hemostats, maybe an Alice. A retractor of some sort. This S retractor is pretty popular for laparoscopic cases. I made out a label for my syringe for the Verys needle, so I'm going to draw up some fluid, about 4 or 5.
So you want us to really do that?
Yep.
Do you want us to really put it in the
We don't really want to make too much of a mess, but I want to know that you know to put it in there.
Okay.
Yep. I'm going to assemble my Graves. I'm going to load one of my acorns. Just going to predict the small. If I have to change it, I'll change it. Put my Telfa over my Curex. And I put everything in order the way that I'm going to use it. So the Graves, then we're going to do local, and then we're going to pass the tenaculum. We'll have a glob of lube here. My dilators are in order from smallest to biggest. Then we're going to do the curette, pass the Telfa. You'll pass the specimen off and say, this is the specimen. You'll physically pass it off, and you'll pass the uterine and manipulator. So everything on my table is in the order that I'm going to pass it. If you have sponge sticks, they are an OB doctor's favorite thing, so go ahead and make them. Not part of your test to make them, but if you have them, make them. When you do these cases in clinicals, you'll be making sponge sticks. Probably several of them throughout the whole case. Also, I forgot some forceps up on my nightstand. Yep, you can leave one light handle on the back table and one light handle on the top. Usually the one that's working at the bottom will put the light handle on so they can aim for the vagina so they can see what they're doing. And then the other light handles for the ones when they work up there. So one clean, one dirty. You'll see that in clinicals as well. So I'm going to go ahead and make my wound towels. Oops, that one over below. Make your wound towels.
What do you mean? I haven't seen them put on until you pull them out.
My patient's already prepped, so I can go ahead and start draping. One closest to me. ChloraPrep takes 3 minutes to dry. It's been well over 3 minutes.
Do you want us to verbalize that before we put on our drapes?
You can say that prep's dry.
Okay.
If you can't successfully get this drape over on this side, you should walk around and put that drape on. The legs, I'm going to stay on the outside so I don't contaminate. Same with this one. What's next?
Lighting.
Lights. Find the toe, step away from my field. Open up. Get my hands underneath the cuffs. I'm going to open. Just make sure that I can get this opening over the middle part and over the foot. This one. I find that when you open it up completely, you can see where you're aiming for. I'm going to watch my back so that I don't contaminate my other legging over here. And I really don't want to put my back to my table over here, so just want to be careful for both sides. Shimmy it on. There you go.
So would it be smart to do that leg first versus the?
You can do whichever leg first as long as you don't contaminate. What's next?
Butt.
Yep. So I'm going to open it up and then I'm going to pinch it off like our, kind of like our man stand. And I'm not going to open it until I actually get to my field. So I can drop it here at the legs and I can go in. I don't want to snag the stirrup legs, the leg covers when I do this. I don't want them pinched in, okay? And after that's put on, get my other drink. Head to head, feet to feet. Okay? I'll lay over the belly to follow the arrows. This part, I don't want to drop my hands. I want to come straight and fix it up here. I can pass this one. My anesthesia. Yep. Thank you, ma'am. So, here in lab, because it's easier, we've been going over the patient's head for throwing stuff off. I just want to show you guys that in clinicals, a lot of times for vaginal cases, the Mayo stand will be between the legs. You guys have seen that before. There's very few cases that we do Mayo stands over the patient's face. It's kind of dangerous because you don't want to smash the nose. So in lab, we've been doing it over the head, which is fine, but I will let you know that in clinicals, you'll see that this, when the patient's in stirrups, will be between the legs. Okay? So, I wanted to show you that before we ran out of more time. So now my surgeon will come in. I'll gown and glove my surgeon. I'll position my table. And then I'll pass my stuff. So can someone tell me the order that I'll be passing?
Graves.
Yep. So I'll pass to Graves, and I want to pass it in the direction that they can just go straight in. Okay? Make it easy on the surgeon. A lot of times they're not going to look up. So what's next?
Local.
Yep. So we'll take the guard off and we'll pass local. The snaculum. Then the dilator. So
Small,
if you,
large, dip
small.
in.
Yep. Dip the one in. Pass. So you have two hands. You can take the one and pass the next one to make the flow nice and smooth. Curette, what are you passing with it?
Telfa.
Okay, and then they're going to tell you what the specimen is, and then they'll pass it off. Okay? And you'll pass it off. But of course you want to ask, is it okay to pass it off? Okay? And then the uterine manipulator, as long as one of these acorns, it makes it on there, I don't care which size. That uterine manipulator doesn't have a size, so it's the only one you're going to pass. We don't count the Veress needle on that one. Why? Because it's disposable. Not that Veress needle over there. Not the plastic one. Kind of falls underneath the trocar. Yep. So I'm going to do a count. We've done the bottom. I'm going to air count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Got one blade. Fred 1, 2, 3 pieces. I've got one pin, one cap, hypos 1 and 2. Okay, that's all of my dirty stuff. I'm going to go ahead and take my gross gloves off.